Today we're going to look at a different kind of iontophoresis patch. It's one where there's a very thin battery built into the patch, and so you don't attach an external device. These are patches that stay on about 14 hours, so once you apply them, you have the client wear them out of the clinic and refrain from getting it wet, but they can take it off after about 14 hours. So the medication we're going to use today is vinegar, which is a negative ion, and so we would put that in the area that needs attention. And with this one, you put the adhesive patch on before you fill the medication, and so we're going to put it right here for lateral epicondylitis today. And for there's a lot of medications that are used, and the medication would come with the client. We don't have access to medications, so we are using vinegar, which has a negative ion. It's similar in terms of its properties to dextromethasone. So we have actually like a syringe that you would fill from a cup of vinegar, and then you're going to saturate the pad through this hole slowly. And in this particular patch, you do not use alcohol to clean the skin before the patch is applied. If you need to clean the skin, you can use like a washcloth and soap and water. But you want to continue applying the medication until the patch is saturated. And it can take no more of the medication. Does that feel cold to you? Mm-hmm. So all right, so we've put 1 milliliter in there, and then I'm going to cover the opening over with a dot. And then the other side that doesn't have the medication, you want to fill with saline solution, which is what's in these pink vials. And the same process, just saturate the pad. A little bit at a time. As much as it's going to hold. You also want to cover that with a dot. All right, and so you instruct the client to leave that on for 14 hours, and it takes that long. It's sort of a passive delivery system, but there is a very thin battery in here that drives the ions through the skin and the medication to the area that's being treated. Let's see. The adhesive may have feel like it's tugging a little bit, but there really should not be any discomfort or pain from the patch. It's a very low level electric current, so they shouldn't feel any tingling or other different sensation. You want to refrain from any vigorous activity while the patch is on, but you can go about your everyday life usually without issues. And you do not want to put it directly in water, but you could shower with it. Just try not to get the pads wet. All right, thank you.